Hello, my name is Kathleen Lisson, and I'm a board-certified massage therapist. I practice in San Diego, California, and my area of expertise is manual lymphatic drainage, which is a type of massage that can reduce edema, reduce swelling after both operations and injuries. And I'd like to share with you today some information about a study that I found. Its title is The Effectiveness of Manual Lymphatic Drainage in Patients with Orthopedic Injuries, and it is published in this Journal of Sport Rehabilitation in 2016. And the authors are with the Athletic Training Program in the University of Northern Iowa in Cedar Falls. So the focused clinical question of the study was, does MLD, which stands for Manual Lymphatic Drainage, improve patient-oriented and disease-oriented outcomes for patients with orthopedic injuries? This study is a wonderful overview of what manual lymphatic drainage is, which is particularly useful for someone who is interested in learning more about the treatment but doesn't really know the background of it. And so what they did is they found studies that were identified as the best available evidence and selected them for inclusion in their inclusion criteria. And they did not include participants with non-orthopedic conditions. So these studies were purely orthopedic conditions. So their clinical bottom line was there is moderate evidence to support the use of MLD techniques for improving patient and disease-oriented outcomes, including edema, range of motion, and activities of daily living in patients with orthopedic injuries. So patients who received MLD treatment experienced significant improvements in at least one outcome in all three of these studies. So I will say they did use level 2 evidence, and they said level 2 evidence supports the use of MLD for improving both the patient and disease-oriented outcomes for orthopedic conditions. So I will put the link to this study in the notes for this video, and I recommend that you definitely read it. It's a great background of information on manual lymphatic drainage and how it can help with orthopedic injuries. I know personally, I first got into manual lymphatic drainage after I got an ankle sprain, and I was given a manual lymphatic drainage just a little bit on my lower leg a few weeks after the injury, and I found improvement. I was able to actually go back to running in just a few months with a combination of me being generally healthy, the manual lymphatic drainage, and some other modalities. I was able to run a half marathon just a few months after my ankle sprain. So I definitely recommend this study, and I hope you have a wonderful day. Thank you for letting me share this information with you.